All right. Let's thank Marilyn for that very comprehensive and thorough introduction. And now that you know everything there is to know about me, y'all can go home now. Seminar's over. I'm driving back to Newport Beach. You're supposed to laugh. Come on. I drove 2 hours to get here. All right. So before we start our seminars, I always like to lay down the housekeeping rules. And the first one is, who did not get this packet when they came in? Okay, raise your hand. So this is a health questionnaire you're going to fill out, and it's going to give me a better idea if what you're suffering from is treatable with our technology. So please fill this out, and I can go over it with you later. Okay, on the back is a survey you're going to fill out, and you're going to rate my performance on a scale of 1 to 10, so I know how I'm doing, and put suggestions on how we could make these seminars more productive in the future. This is an announcement of locations of future seminars, future topics. So pass this on to a loved one if these conditions do not apply to you. Okay? So the first rule of the seminar is the most important one, and that is, we're going to have fun. Can you agree on that? Great, okay. Number 2, if you have a question, I'll answer anything except what's the meaning of life. But you're not going to ask it during the seminar because A, I got a lot of material to cover. We don't want to disturb our neighbors. And B, I'm not allowed to answer your personal health questions in public because something called HIPAA violation, whatever that means. So questions at the end with me, one-on-one at the table. Can we agree on that? Great. Number 4, I'm going to ask you guys questions because I don't want you to do one of these. So if I ask you a question, please participate. Can you agree on that? Number 5, please put your cell phones on silent. Pretend we're at the movies. We don't want to disturb our neighbors. And 6, if you want to get back to a pain-free, active, and healthy lifestyle, you're going to take action. Can you agree on that? Great. So without further ado, we will start the seminar. So I just got back from Miami because I'm part of what's called the American Academy of Stem Cell Physicians. And we convene every week to exchange the best practice ideas of how to apply regenerative medicine. We actually meet every day because we're in a group chat. We talk about cases, difficult cases, what's working, what's not. So the founder of the American Academy of Stem Cell Doctors is Dr. A.J. Farshian, and he used to be Michael Jackson's personal physician. He's the one that tried to detox Jackson before he got addicted to drugs. He wasn't the guy who made him overdose. There was another doctor who was in jail. And Dr. Farshian was going to build a children's hospital for Michael Jackson because he's with Michael Jackson for children with untreatable diseases, but obviously they weren't able to do that together. So he's also a humanitarian. You can think of me as like I'm more your healthcare educator, okay? And the real Wizard of Oz behind the curtain is our medical director. This is Dr. Reynaldo Landero, and for over 50 years he's been a medical internal medicine specialist, pulmonologist, and geriatric specialist. This is a picture of us combining our different treatment modalities. This gentleman had COPD, sepsis of the lung, and emphysema. So Dr. Landero, he IV'd some umbilical cord stem cells. I put my laser panel on his chest to activate the stem cells. He survived the sepsis. His pulmonologist said he had some benign tumors growing in his lungs which are disappearing, and now he's walking and breathing without oxygen. So it's not just pain we're concerned about, it's function and health for all your organs in your whole body. Dr. Landero got an award from Mrs. Governor Brown in 1978 after Dr. Landero graduated from UCLA medical school residency. Even the Bushes, today's President's Day, right? Recognized Dr. Landero for his great contribution in healthcare. But this seminar is not about us doctors. It's actually about you, okay? Because if you are 55 years and older, but you still think you're 35, okay? Like me, I'm 50, but I still think I'm 20. And the problem is we all don't want to give up the activities we did when you were 35. Some of you want to play racket sports, but you can't lift the club above your shoulder because of killing shoulder, killing neck, killing back, or a killing knee. Some of you would just like to be able to walk up and down the stairs without holding onto the rail. Or you're thinking you're going to fall down the stairs because you have numbness in your feet. Who would like to take another cruise to Europe, to the Mediterranean? Well, what's the use of flying all the way there? Because you're going to be stuck in your stateroom because you can't manage those cobblestone streets in Spain or walk El Camino because of poor balance, bone-on-bone knees or hips, or a killing back. First question, how many steps do they say you have to take a day for optimal health? Some of you can't even take 10 steps without excruciating pain, numbness, dysfunction in your feet, knees, hips, or back. Some of you would like to get 18 holes of golf to get your 10,000 rounds, get your 10,000 steps, but you can't even swing the golf club without excruciating pain, numbness in your knee, hip, back, or feet. If you've tried everything to manage your back pain, your arthritis pain, your knee pain, your hip pain, your benign tremors, you've been to Dr. Wine, Dr. Stein, Dr. Lee, Rosenberg, Smith, Jones. You've been to Eisenhower Hospital, JFK Hospital. You've been to Kaiser, Hoag, Mayo Clinic, Cleveland Clinic. Some of you have even done medical tourism and flew to Germany or Panama. And you're sick and tired of being prescribed a bunch of pills, take this and call me in the morning, with who knows what side effects they have,